You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, last weekend, to Greg's point, some 20,000 people, new cases of COVID-19 in this country. Now we've been seeing hundreds of thousands of protesters across the country out there, not social distancing, packed in very close quarters, raising new concerns about the spread of coronavirus. In a moment, we're about to talk to Kimberly Butler Willis, actually two health experts about this particular issue. To Greg, Reese, and Erica, I'll be honest with you. I've been torn the last couple of days because, look, in a normal world, I'll be headed to Houston on Sunday to cover the marches as well as the events for George Floyd. We went to the same high school. It's in Houston. The church that his funeral is going to be at, my parents were members of that particular church. I know the pastor and his wife is very well. But I'm sitting there going, that means getting on a plane. That means getting a rental car. That means being around lots of different people. And to Greg's point, when I saw that funeral today, man, I saw folk not wearing masks, not wearing gloves, hugging, kissing, sitting next to each other. And I'm sitting there going, and so, I text a number of people, fellow journalists and others, and I had some other folks who were like, hey, Ro, you the only host of your show. You can't get sick. We need you exactly where you are. And this thing is just real in terms of this. And we know for 33 black preachers and bishops have died. Funerals have been incubators for coronavirus.
Roland, I thought about us last weekend, man. Your nephew Solomon, my nephew Ellington. These two brothers known each other since they were little boys. I held that boy in my hands as a baby. Both them boys came out of Walnut Ridge High School last weekend, and neither one of us was there. That's heartbroken.
Yep.
That's heartbreaking. And that's a moment of celebration. To not be able to mourn. You got the last interview with our dear brother, Conrad Worrell. I'll be normally getting ready to go to Chicago for the ritual, but we won't be able to do it. Roland, I'm telling you, man, these young people, they've been they're not social distancing. They were masked up, but when in front of 16th and H this afternoon about 2 o'clock, when they met up, the two big streams before they did the die-in, the two young brothers who were in the front and the sisters who were beside them in the front embraced when they converged, and I winced. They're strong. I'm 55 years old. I'm at a distance with my mask and gloves on, but I understand that this could have profound implications for not only them, but everybody who lives in their household. And it's multiracial. It was every social and economic class. It was every race. And then they're going somewhere to sleep. They're going home. Roland, we are in uncharted territory, man. And getting together in a church, I know this was important, but maybe they should have had it outside instead of the University of Central Minnesota. Maybe it should have been somewhere other than that church. There's not a logic for this at this point that I can see.
And Greg, you just mentioned that. Go ahead and take my iPad, please. And so you mentioned your nephew and my nephew both graduated last week. And so that's the photo of the both of them. So we want to go ahead and give them a shout out there. Let's go to Kimberly Butler Willis. She's director of the Ryan White. Okay, they're getting her sound together. Y'all, let me know when she's there and Dr. Underwood are both there. Reese, look, this is real. And I mean, look, I appreciate what I'm seeing with the protests out there, but and look, people are putting their lives on the line out there protesting, being in close contact. That's real. But we also have to think about that. And same thing, look, I get Reverend Sharpton and them talking about a march in Washington on August 28th. I don't know about putting a bunch of black folks on buses and planes and coming for a march in Washington. That's just, we got to be real about this.
We do. I was watching the memorial, and I just had this irrational, just hope that maybe, enough people have on masks, or maybe it's not as bad as what this data unequivocally tells us is bad, because people really have this cathartic need to release and to be together and to protest, and it's completely rational for that need and for them to express that need in the way that we see. But it's also terrifying to see the great dangers that people are putting themselves in. And to Dr. Greg's point, Carr's point, we're in uncharted territory. We have a pandemic and massive uprisings. And in a week from now, we will see what the situation is. But I mean, I can't help but go back and forth between this just irrational hope that maybe it just won't be as bad. And so I'm glad you have these experts on the panel tonight. But I'm torn like you all are, because I would love to be out there. I was out there protesting the Brett Kavanaugh. That was the last real big march that we had out here in DC area. And but this pandemic just really makes me take pause and be torn.
Erica.
Yeah, and thinking about all of this, I'm just reminded I've been working from home for about 14 weeks, and early on lost the first of one of my dear friends, Femi Anderson, from COVID-19, and her lost her in late March, and her wanted to immediately go to her funeral because that's a dear sister and was a dear friend of mine, but was constrained. I had to push past emotion and watched her funeral live stream the day after my birthday on April the 4th. And so I understand really people wanting to get out and to make their voices heard and to make their voices known. And it really is a real thing for the Black community that even though that we are in, as Dr. Carr said, uncharted territories, that there are always these life and death decisions that our community is forced to make, sometimes on a daily basis. And so I get it, I understand it. I think that kind of moving forward, that's one thing that really needs to be taken into conversation, like with the experts that you're going to have on today, because Dr. Carr mentioned this as well, talking about the Reverend Dr. William Barber and the whole Poor People's Campaign that they've been planning for well a year in advance, that they are holding virtually. And so hopefully that there will be people that have expertise that are able to get to the folks that are organizing this march that Reverend Sharpton announced, to just do it in a different way, because, Congress, at least the House side, is not in session. They're not there now. And so those are things that really just have to be considered and galvanized in the heart of the people.
I want to pull up right now Kimberly Butler Willis. She's the director, the Ryan White Wellness Center, and managing director of Goodstock Consulting. Glad to have you on the show. Also joining us right now is Dr. Janice Underwood, Chief Diversity, Equity, and Inclusion Officer for the Commonwealth of Virginia. Dr. Underwood, I'll start with you. We saw 20,000 new cases last week of COVID-19, marches taking place. We saw the funeral today for George Floyd. I didn't see social distancing being practiced, not everybody wearing masks as well. That is of concern, that to have hundreds of thousands of people protesting could very well lead to a dramatic spike in COVID-19 in cities across the country. Do you share the same concern?
I not only share the same concern, Roland, I know that we are in a pandemic that is disproportionately killing Black, brown, and Native lives at alarming rates. The issue, though, however, is that there has been a public health crisis that have been killing Black, brown, and Native lives for the last 400 years. And so I think what people are saying is that we realize that we're in a pandemic, but so many people are fed up and tired of a knee on their neck, and they want their voices heard. And so I'm excited about the work we're doing in Virginia to address both public health crises.
Dr. Willis, are you there?
I'm here. I'm struggling with my tech, but I am here.
All right, as we can work with you on that one, and that very simple. You're an expert there in public health. Again, what must be done for us to properly deal with this issue? Because, yeah, we are being disproportionately impacted, and I totally get folks wanting to be out there. And like I made the point before y'all came on, look, I'm from Houston. I will be covering the George Floyd funeral. I'm choosing not to go, scared to death, because again, you're going to be having people. I'm from there. Folks going to be hugging. You're not going. Again, not necessarily spread out. I mean, that's an issue, and we've seen churches be incubators for COVID-19.
Absolutely. You know, Roland, it's funny that you say that. I had my best friend, she lost someone in her family. So we went to comfort her, and we found out that the preacher who led that graveside burial was indeed positive for COVID. So how do you navigate, right? As human beings, we know that the sense of touch and community, especially in the Black community, is essential. And especially during these traumatic experiences that we're all going through. So I say proceed with caution. We all have good sense, and we know exactly when we should be in crowds, when we should not be in crowds. I think we've been giving good directives about keeping it between 10 and below, and quarantining, as they're calling it. So only congregating with people that you know have been practicing the same healthy choices that you have been making as well. So using good common sense that I know we all have, but also being very cautious, because we're seeing those rates increase. And it's not because of the protesting, but because of these relaxed re-entry laws that we've since implemented starting Memorial Day.
Questions from each one of my panelists. I'll first start with Reese Colbert. Reese, what's your question for Dr. Underwood and Dr. Willis?
Thank you, ladies, doctors, for joining the panel. My question is, how do we break through in terms of people at least understanding how to wear a mask properly? I saw so many people today at the memorial service who had their mask, below their nose, under, basically falling off their face. How do we break through to people the importance of really making sure that if you are going to be out and you do have a mask, that you need to wear the mask properly the entire time that you are vulnerable or susceptible to any kind of transmission?
Is this it? Is this it? Where it covers your nose and it goes down to your chin? Is that it?
Yes, that is it.
Very
and this
good.
is the best. This is a favorite conversation for our medical director, Dr. Ebony Hilton. She is persistent and relentless about wearing PPE as it should be worn. And you want to make sure that you're covering the nose and the mouth, because remember, COVID is transmitted by respiratory droplets. It's an aerosol disease. So you want to make sure that you're keeping all of those airways closed so that you're being as safe and cautious as possible. And Dr. Underwood, I'll toss to you for any other advice you would offer.
Yeah, I think that it's important, though, that we understand that this is new for all of us. Just like this is a novel coronavirus, it is also very important that we understand that these are new ideas of wearing a mask in public. There are even laws on the books that suggest in Virginia that we're not allowed to wear masks to cover our face. And so as we socialize into reopening, we have to use these measures to protect lives and livelihoods. So one of the things that the Health Equity Task Force of the Virginia Unified Command is trying to think about is, how do we create campaigns that socialize the public into wearing masks? Because we know that there are so many people, specifically African-American men, who don't feel comfortable walking into stores with a mask for fear that they will be viewed as a threat by, folks like Amy Cooper or others, or law enforcement. And so on one hand, you want to wear the mask to save your life, but on the other hand, you're worried that perhaps having a mask on may be detrimental to your life. So how do we socialize our communities and our neighbors and those that we go into stores, grocery stores with, and doctors' offices? How do we socialize each other to wearing the mask and how to wear them correctly, like you said, Roland? Because these are what's going to flatten the curve, and this is what's going to help us as we think about until we get a treatment for this, right? We have no treatment. So this is all we have: social distancing and wearing a mask and washing your hands.
And making sure that you're not touching that mask with your face. So again, the PPE is there to protect those membranes, because we know that that's where the disease wants to go. So once you have that mask on, conditioning yourself not to touch your face, because again, you do not want to pass that virus on from your hands. So washing your hands as much as often, as much as possible in making sure to cover those airways. Essential.
Want to go to Greg here. I will say this here. I was watching it again. I was watching the memorial service, and there was a woman who was at the pulpit. She was talking, and she wiped her nose, touched her nose, and then placed her hand back on the podium. I was like, yeah, I know somebody's gonna be touching that podium. I mean, again, it's just things you now think about. Greg, your question.
And then I touched my head. Well, I don't wash my hands 15 times. But, first of all, thank you, Dr. Underwood, Dr. Willis. I have a question as it relates to advice you might have for the folks who are out there protesting. I saw a lot of people with masks, a lot of people with gloves, but then I saw a lot of support stuff being handed around. Water, fruit, all coming people. I mean, is there a protocol? And I know we're in uncharted territory, but what would you say to folks who are going to go out and demonstrate? And in your case, that anyway, I'm thinking about the police we got. I see all these police with no masks on. Is there a word for them, not just as law enforcement, but as human beings, because they themselves are susceptible? Not that I'm just saying, is there a protocol that everybody should be following at these protests?
Absolutely. And I say the best way to get that message across is for you to model that. So for you to make sure that you are interceding when you see someone not wearing their mask correctly, or when you see someone that is unmasked, because the worst thing that could happen is that from this protest and this uprising, which I think is essential for us causing a revolutionary and radical change in this country, is for us to then die because of it, especially from a disease that we can prevent. And so if we do want to go out there and we want to assist our protesters, because there's a lane for everyone, and we need these people causing a radical stir in our country, we want to make sure that we're supporting them and giving them the education that they need. And so if you go out, make sure that you model, take extra masks, make sure that they have exactly what they need, take the water, but take educational information as well so that they have all of the information they need to stay safe as we change this country.
Erica?
Yeah, appreciate both of you ladies. One of the things that I've also kind of been reading around is people actually covering their eyes, and that when they go into supermarkets, not to necessarily have gloves on. Could you both please educate us on, do we actually also need to be protecting our eyes as well when we walk outside of our homes and engage the public? And should we or should we not be wearing gloves?
Well,
so go ahead, Dr. Underwood. I'll volley that to you.
Wearing gloves is kind of like a double-edged sword, because you can wear gloves and get the virus on the gloves and then touch your face, and then you've still got the virus. So the gloves are really a deterrent to keep you from touching your face. We know that we touch our face hundreds of times during the day. And so the gloves sometimes can give you a false sense of security, but not to say that you can't wear gloves as long as you understand that you still shouldn't touch your face with those gloves. The other thing about covering your eyes is, I think it just really underscores the idea of really limiting how much you go outside. We have to have our eyes with regard to driving and navigating the landscape. And so if you think that it is not necessary for you to go out to a grocery store or go out to a particular event, then don't go, and limit how much you go out, because you are putting yourself at risk every time you go out. You cannot cover your eyes. And I'd just like to also underscore that sometimes, and there are people with disabilities or different abilities that have a hard time even with the mask on. So some masks are see-through, so that people that are reading lips can actually see someone else's lips so that they can understand what you're saying. So there are lots of different accommodations that can be made and that are being made. But I wouldn't recommend anyone covering their eyes. What I would recommend is limiting how much you go out and put yourself and your family at risk.
Absolutely.
All right. Well, look, we certainly appreciate both of you for the advice. Dr. Underwood, Dr. Willis, we certainly appreciate it. Thanks a lot.
Thank you for having us.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, folks, we support black-owned companies. The folks at Ceek.com. Sister Mary Spiel, she created, of course, these headphones as well as this virtual reality headset right here. Phenomenal. The headset, of course, 360-degree 4D. It's unbelievable sound. In addition to the VR headset you see right here, if you, of course, just pop it open, slide your phone right into it. You can look at the content on Ceek.com as well as other 360-degree videos. It's really, really great. All this created by this sister, Black-owned, folks. Go to Ceek.com, Ceek.com. Put in this code right here, RMVIP2020, RMVIP2020. And you can actually get that. So, of course, using that code, part of the proceeds go back to our show. This is what we do. Black businesses, helping black businesses, all been able to grow and thrive together. And so we certainly appreciate partnering with them.